Good morning, ladies and gentlemen.
Two of my very good friends, Saroj Mishra. Professor Mishra, can we have you up? And Dr. Frank Levens. Saroj Mishra, I really think deserves to be called the father of telemedicine in India. He is an endocrine surgeon by training, professor of endocrine surgery at SGPGI Lucknow. He has set up a fantastic department at SGPGI. Then he heads the National Institute of Telemedicine and Medical Informatics. Dr. Mishra. Frank Ray, treasurer of the International Society for Telemedicine and E-Health. He has been holding a conference in Luxembourg for the last 12 years. For the last 12 years, which has been attended by delegates from all over the world. Thank you, Frank, for coming. I now hand over the conduct of this session. Please remember, you are being watched by thousands of people all over the world. Thank you.
This will be posted in the portal and you can have access to that. So we are not going to miss anything, and Dr. Ganpati said that it is still being circulated through Twitter and webcasting, so people are not here, I'm sure they must be watching it. So I join my friend Frank to welcome all to the first session of this third conference. I must thank the Apollo Group of Hospital and the management to continue this academic exercise, which is what is needed for our country to develop awareness for the telemedicine and e-health. So with that little introduction, so I'd like to, is somebody going to introduce the speaker? Or we'll go into the speaker. Okay, so now I request one of this organizing team to introduce the speakers. We have, I believe, 4 speakers. There are some dropout. And may I request, okay. So I request you to introduce the speakers for this session and then call them. Let Frank to say a few words before it.
Hello everybody, good morning. It's my pleasure and privilege again to be here in India. I've followed the evolution in the last 6-7 years or more of telemedicine here, and I must say I'm very impressed, and I see this movement going on very strongly. This country needs e-health, needs the use of IT more than anyone else, and I'm glad to see that this is going on. It's a very positive sign, so it's also the reason for me to be here and give the support of the International Association, the International Society for Telemedicine and E-Health. Yeah. Possible to just cover everything in just a few minutes, but I think it's important also to try to have a global view on what's happening in the world. You have to concentrate on what you do every day, obviously, but you also have to be aware in which context, globally, worldwide, all this happens. And I think this is our task as international society, to try to communicate some knowledge, some experience from that side. I've been asked to start this conference and by giving you an overview of e-health in Europe. A few facts. Europe is the 6th largest continent, which means also the smallest in the world. It's only 2% of the Earth's surface, but it has 50 internationally recognized sovereign states with 23 languages, 500 million population, which is only half of the population of India, just to put it into perspective. The main issues in Europe is, first, the demography. As you can see, the percentage of working age people has been diminishing over the last years and is going on in the perspective toward 2060 is that it would diminish with, say, more than 10% as the population of 65 plus is at the same time almost doubling. The cost is another issue. Chronic diseases are 80% of the disease burden, and over 100 million citizens are reported to have chronic diseases. 70% or more of healthcare costs are spent on these chronic diseases. In the European Union alone, and it's still going to go up. At the same time, you know, the borders are open in Europe, so there's a lot of mobility, and that needs also to be covered as far as health is concerned. So the solution is really using modern communication technologies to meet the needs of citizens, patients, healthcare professionals, healthcare providers, as well as policymakers, as was stated by the European Union Declaration of Ministers of Health. And also the WHO is recognizing e-health as the way to achieve cost-effective and secure use of information and communication technology for health and related fields. European Union health policies, already back in 2004, the first formal commitment expressed by all member states to cooperate more closely in the area of e-health and to develop a national or regional roadmap for e-health. And as you can see in this chart, actually in certain fields of activity, all 27 members are already active, and the number has grown since 2004. So all the countries are really involved in e-health. Nobody is staying behind. Moving European Union towards the European e-health area is one of the strategies by 2020, coordinating actions and promoting synergies between related policies and stakeholders as to develop better solutions, prevent market fragmentation and disseminate best practice. So the specific objectives are to create an electronic health record architecture, to set up health information networks between point of care, to coordinate reactions to health threats, to ensure online health services such as information on healthy living and illness prevention, and to develop teleconsultation, e-prescribing, e-referral, and e-reimbursement capabilities. And the European Commission is leading the 2020 strategy and has published already several documents which you can find on their website. There are 5 levels to change the healthcare in Europe. The data. Individuals are the owners and controllers of their own health data. The main benefits are for patients who are empowered to manage their own health if they wish. And the issue to consider is being data safety and transparency. To liberate the data, and there the main benefits are accelerated innovation and increased scale and spread across all actors. Whereas the issue to consider will be the quality of these data. Connect up everything, of course. Communication is center of our lives nowadays. But you have to consider the lifestyle versus health, the quality, who sets the quality and technical standards, the ownership, who owns the information, and the external interoperability. Revolutionize health. Main benefit, of course, is good multidisciplinary care that will be recognized and delivered. But there again, attention, transparency, awareness, and understanding. and to include everyone, but how to balance individual rights, such as the right to know about generic profiles and the right to not to know, etc. So you see, there are lots of possibilities, but there are also the drawbacks, and we have to watch that. So let time also do its own work. And here you'll find that when you go through the slides, which will be available. I'm not going to go into details here, but these give you examples of achievements in several European countries. In summary, Europe has done a lot towards wide development and implementation of e-health under the guidance of the European Commission and several other organizations. Yet, Europe does not have a monopoly on how e-health has to be practiced. And I think that we can say that Europe is always ready to coordinate actions, share expertise, exchange knowledge, and learn from the rest of the world, because e-health is truly global. And quickly to end, I'd like to just say a few words about the International Society for Telemedicine and E-Health, which is the International Federation of National Associations who represent their country's telemedicine and e-health stakeholders, and we're very glad to have the TSI, the Telemedicine Society of India, as the national representative for India. The mission is to exist to facilitate the international dissemination of knowledge and experience in telemedicine and e-health, and to provide access to recognized experts in the field worldwide. Nowadays we have members, either national individuals, institutional corporations, whatever, from 73 countries and territories around the world, which allows us really to call ourselves truly international. We are in contact with WHO, ITO, all the major international organizations.